Paul Drews, you the man. Now, dealing with chronic pain can be very challenging, and at times it may even seem hopeless to try. Our next guest and his staff are trained to assess your pain condition and provide you with the best possible treatment options. Here from Oahu Pain Care is owner Dr. Louis. Is it Louis or Louis?
Louis.
Louis Powell,
Yeah.
MD. Wow, Dr. Aloha, Dr. Powell. How are
Hello,
you?
hello.
Thank you so much for joining us.
Oh, mahalo.
We appreciate it. Now, today we're going to talk a little bit about spine fractures.
Yes.
Before we kind of dive into the whole thing, how many people in the U.S. suffer from spine fractures, and what are some of the causes?
The most common cause is osteoporosis, and it's based upon the age. 80% is female, 20% is males, and the older you get, the more likely it is. So when you're in the 50s, probably 20%. When you're in your 60s, we're up to 40%. When you're in your 70s, then you start getting into the 80% of them will start having osteoporosis and fractures.
So, I mean, that sounds pretty scary. I mean, we talked like spine fracture, like especially the spine. You're like, oh my gosh. So, what does that mean? Like a spine fracture, what could that mean?
So the spine is made out of vertebrae, which is like cans of soup stacked on each other.
Okay.
And they have too much pressure. Usually it's forward bending, and then they're fracturing and they go into like a wedge shape, so they start bending forward. And that's why when you see a lot of old Asian women, they're bent forward when they're walking. They're not doing it purposely looking for money, but they're doing it because their spine is tilted.
Ah, I see.
Wow. No.
We're actually taking a look at some of the pictures that you provided of the different, vertebrae.
Now, Dr. Powell, what are the treatments for painful vertebral or spine fractures?
So if it's non-painful, we just do medication management, bracing, physical therapy. If they're fractured, we usually like to do a kyphoplasty procedure. And what that is we will insert a needle into the bone, and we'll try to bring the wedge fracture back to its normal height, and then with a balloon, and then we deflate it, and then we put methyl methacrylate, which is crazy glue, medical crazy glue in there, and it fixes it in that height.
Wow, you make it sound so easy.
It is easy.
Well, I mean, you're a doctor, you get all the experience. So what happens if we don't receive the appropriate treatment?
So they did a study out of the Oxford University where they had people who had fractures, and they just monitored them. Some of them got treatment and some didn't. So those who had treatment, they had a quick resolution of their pain. And those that were treated conservatively, which is physical therapy, medications, and exercise, 60% of them, their pain was worse a year later as when they first had it.
Wow.
Wow. Is there a way to prevent osteoporosis?
Yes, so I mean, basically weight-bearing exercises is helpful. The other one is eating natto is really good in preventing. Yes.
Oh my God.
Well, I never thought of
You got to get past the...
Yeah.
the smell and the slime. And
Yeah.
Yeah.
I
Okay.
haven't, you're Japanese, but I've never tried that.
I used to eat it when I was younger, and then all of a sudden my taste buds took hold, and I went, I'd rather have chocolate.
You got to get back.
Yeah, I know,
to because I mean, we don't get that. We're getting a little bit older ourselves,
No,
don't we? You know what I'm saying?
As we're talking to you, I'm starting to try to sit straighter at the chair.
We're sitting up straight. Now, we do have some information. If you want to call Dr. Paul and make an appointment at the Oahu Pain Care, you can see the number is up on your screen. Also, the website, oahupaincare.com. Dr. Paul, this was very insightful. And now I'm like Devin said, I'm going to try to practice these moves over here.
And we might have to go eat natto after this.
right after work. All right, Doc, thank you so much for being
you,
here.
mahalo.
I appreciate it. Please come back anytime.